The president's surprising supporters gathered at Walter Reed Hospital this evening, wearing a mask and flashing two thumbs up inside his motorcade as it passed. The White House says this move was cleared by his medical team as safe. Today, his doctors insisting he is doing very well and that he could be ready for discharge as early as tomorrow. But some are questioning that based on the medication he's taking, dexamethasone. Here's William Joy.
Since we spoke last, the president has continued to improve.
The world is watching Walter Reed Medical Center, where a team of doctors is caring for President Trump after he tested positive for COVID-19.
Here's the reality. We don't have a crystal ball.
Dr. Mark Casanova is the president of the Dallas County Medical Society. He's closely watching the president's need for oxygen after his saturation fell into the low 90s and possibly below.
That's a clear indication that it's taking a toll on our system.
There's so much uncertainty with it.
Crystal Howell is an infectious disease pharmacist at UNT-HSC. She says the president taking antiviral Remdesivir isn't surprising, but adding the steroid dexamethasone may mean the president is struggling.
I would say that I'm a little concerned. He does have multiple risk factors.
The president's doctor said Sunday Trump has needed oxygen twice after not answering questions about that Saturday. Sunday, they wouldn't answer questions about scans of the president's lungs, which would show if he has signs of pneumonia.
The individual who had those findings is definitely, at a minimum, in a moderate risk category.
The president's team added that if things improve, he could begin the discharge process Monday.
Nothing happens very quickly in medicine unless it's in the wrong direction. So as long as we're not hearing about changes constantly, that's usually a good sign.
Both Howell and Casanova say his stay is a reminder of the importance of masks and distancing.
COVID-19 does not know boundaries. It doesn't care who you are.
In Fort Worth, I'm William Joy.
Texas Governor Greg Abbott is responding to the news of the president's improving condition, tweeting, "Looks like Donald Trump is making a swift recovery from COVID. So many prayers answered." Former Vice President Joe Biden has tested negative for a third time. He was in the same room as the president, of course, last Tuesday for their debate. ABC News is reporting that the president tested positive before making an appearance on Fox News Thursday evening. So that would mean he would have been highly contagious during the debate. The White House has been working to trace a flurry of new infections of aides and allies who've been in close contact with the president this week. They're focusing particularly on last Saturday's White House event announcing Judge Amy Coney Barrett as President Trump's Supreme Court nominee. More than 150 people gathered in the White House Rose Garden that day, where they mingled, hugged, and shook hands, many of them without masks. Former New Jersey Governor Chris Christie and former White House counselor Kellyanne Conway are among at least 8 people who were at that event who have since tested positive for COVID-19. We will be watching for any developments regarding the president's health at all hours. You can look for updates on air and anytime at WFAA.com.